Next, let me discuss the calcineurin inhibitors used in the dermatology. And if you take this calcineurin inhibitors which are used in dermatology, the drug, it includes cyclosporin. Now let me tell you in which all clinical conditions this particular cyclosporin is used. Remember, it is used in case of atopic dermatitis. So this cyclosporin, it is used in case of atopic dermatitis, used in case of the psoriasis, and also used in case of alopecia, right? Used in case of the alopecia areata, and a type of pemphigus, that is pemphigus vulgaris, right? Pemphigus vulgaris. And next, it is also used in case of bullous pemphigoid, right? Also used in case of bullous pemphigoid. Next, used in case of lichen planus, right? Used in case of the lichen planus. And lastly, pyoderma gangrenosum, right? Pyoderma gangrenosum. So these are the clinical conditions where this particular cyclosporin is being used. Now, in calcineurin inhibitors, apart from cyclosporin, the other drugs in the calcineurin inhibitors include tacrolimus and as well as pimecrolimus. So remember, the tacrolimus and as well as the pimecrolimus. So these are the other agents in this calcineurin inhibitors. Next, apart from calcineurin inhibitors, the next group of drugs which are used in dermatology, like we have the biological agents, right? Next we have the biological agents. Now if you take these biological agents, the drugs in this particular group which are used in dermatology, they include number 1, alifacept and as well as 𝐒𝐵𝐼𝐿𝐼𝐿. Alifacept and as well as 𝐒𝐵𝐼𝐿𝐼𝐿, they are approved for moderate to severe psoriasis, right? Alifacept, and as well as the other drug we have 𝐒𝐵𝐼𝐿𝐼𝐿. So these two drugs, remember, they are used in case of moderate to severe psoriasis. Next, the other drug like what we have is etanercept, right? The other drug what we have is the etanercept. Now if you take this etanercept, remember, it is approved for psoriasis, rheumatoid arthritis and ankylosing spondylitis, right? Approved for psoriasis, rheumatoid arthritis and ankylosing spondylitis, right? So these are the clinical conditions where the drug etanercept is being used. Next, we have another biological agent which is called as infliximab. Remember, this particular infliximab, it is approved for the Crohn's disease, rheumatoid arthritis, and is in phase and it is in trials for the treatment of psoriasis, right? Approved for the treatment of Crohn's disease, rheumatoid arthritis, and as well as in psoriasis, right? As well as in psoriasis. Next, and another biological agent we have which is called as 𝐷𝐼𝐿𝐼𝐿 diftitox. So if you take this drug 𝐷𝐼𝐿𝐼𝐿 diftitox, remember, it is indicated for advanced cutaneous T-cell lymphoma, right? Advanced cutaneous T-cell lymphoma. So these are your biological agents. So let me shortly revise both these calcineurin inhibitors and biological agents. Calcineurin inhibitors, they include cyclosporin, which is used for atopic dermatitis, psoriasis, alopecia areata, pemphigus vulgaris, bullous pemphigoid, lichen planus, and as well as pyoderma gangrenosum. And the other drugs in this calcineurin inhibitors, they include tacrolimus and as well as the pimecrolimus. Biological agents, if you take, that include alifacept and as well as 𝐒𝐵𝐼𝐿𝐼𝐿. They are used in the treatment of moderate to severe psoriasis. Then we have etanercept used in the treatment of psoriasis, rheumatoid arthritis and ankylosing spondylitis. Infliximab, it is approved for Crohn's disease and rheumatoid arthritis and it is in trials in the treatment of psoriasis. And then you take the drug 𝐷𝐼𝐿𝐼𝐿 diftitox, it is indicated for advanced cutaneous T-cell lymphoma. Next, let me discuss the sunscreens used in the dermatology. Now, if you take these sunscreens, Like this particular sunscreens, they may protect the skin, right? They may protect the skin from UVA light or UVB light. Now, you take the sunscreens which are protecting the skin from UVA. They include avobenzone, right? That include avobenzone. Next we have oxybenzone, right? Then we have oxybenzone. Then we have a drug called titanium oxide, right? We have a drug called titanium oxide, and next we have zinc oxide, right? Next we have zinc oxide. So these are the sunscreens which are being used against UVA. Next, let me tell you the sunscreens which are used against UVB. They include cinnamates, right? They include cinnamates, and then we have salicylates, right? Then we have salicylates. So these are the drugs which are used, sunscreens which are being used against UVA and as well as UVB. Now, like we have an entity which tells us the efficacy of this particular sunscreens, and that entity is called as the sun protection factor, right? We have an entity called sun protection factor. Now, if you take this sun protection factor, which is being given by the terminology SPF. So, if you take this sun protection factor, it is being defined as, it is actually a ratio, right? Ratio of the erythema which is being produced on the skin with sunscreens and without sunscreen, right? So it is the ratio of, right? It is a ratio of minimal dose of sunlight, right? Minimal dose of sunlight that produce erythema, right? That produce erythema on skin, right? That produce erythema on skin with, right? With sunscreens to that of, right? To that of without sunscreen. Okay, so basically has to produce erythema, right? And that particular erythema which is being produced with sunscreen over the skin to that of without sunscreen over the skin, and that will define the sun protection factor, right? Now this particular sun protection factor, it provides a valuable information regarding UVB protection but is useless for UVA efficacy, right? So this sun protection factor, it tells you only about the UVB protection, right? It provides a valuable information regarding, right? It provides the valuable information regarding the UVB protection, but it is useless, right? It is useless for UVA efficacy. Okay, so that is about your sun protection factor. So remember, if you take these particular sunscreens, these sunscreens will protect the skin from UVA and as well as UVB light. And the sunscreens which protect from UVA, they include avobenzone, then we have oxybenzone, then next we have titanium oxide and zinc oxide. And the sunscreens against UVB will be cinnamates and salicylates. And the efficacy is determined by the sun protection factor. The sun protection factor, it defines the ratio of minimal dose of sunlight that produce erythema on the skin with sunscreens to that of without sunscreens. And this sun protection factor, it provides valuable information regarding the UVB protection, but it is useless for UVA efficacy. Now, after sunscreens, let me discuss the other agents used in the treatment of the dermatological issues. Now you see, we have a clinical entity which is called as cholestasis, right, where there is stasis of bile within the gallbladder. In this particular cholestasis, the individual will have pruritus. Now cholestasis associated pruritus, it can be treated by certain drugs, and let me discuss that first. Remember, cholestasis associated pruritus, it is used, or this particular cholestasis associated pruritus may respond to a drug called, or a substance called cholestyramine, right? Next it responds to ursodeoxycholic acid, right? Next to the 𝗓𝐸𝐷𝐸oxycholic acid, it also responds to ondansetron and then to an anti-tubercular drug which is called as the rifampicin, which is a first line anti-tubercular drug, and this cholestasis associated pruritus also responds to your nalmefene. And remember, this particular nalmefene, it is an opioid antagonist, right? It is an opioid antagonist. So this is about your cholestasis associated pruritus. Next you take in patients with chronic renal failure, they have what is called as uremia. Uremia can also cause pruritus, right? Uremia can also cause pruritus. Next, the pruritus of uremia is most effectively treated with UVB radiation, right? Treated with UVB radiation. Next, remember, this pruritus of uremia not only responds to UVB radiation, this uremia of pruritus may also respond to naltrexone and as well as omeprazole, right? Also responds to naltrexone and as well as omeprazole. Okay, so this is about your pruritus associated with uremia. Next, now you take the clinical conditions like post-herpetic neuralgia. In case of post-herpetic neuralgia and as well as diabetic neuropathy, the individual will have burning sensations over the skin, right? So this painful burning sensation of the post-herpetic neuralgia, right? The painful burning sensations of post-herpetic neuralgia and as well as the diabetic neuropathy, right? As well as the diabetic neuropathy. These clinical conditions, they can be treated by substance called as, right? Substance called as the capsaicin. All right. Next to this particular post-herpetic neuralgia and diabetic neuropathy, let me tell you the another drug which is called as masoprocol. Now you take this drug masoprocol. Remember, it is a potent 5-lipoxygenase inhibitor with anti-tumor activity, and this is effective for topical treatment of actinic keratosis, right? This is effective in the topical treatment of actinic keratosis. And what is this? It is a potent 5-lipoxygenase inhibitor. All right, and this particular masoprocol, it has the anti-tumor activity, right? It has anti-tumor activity. So that is about your masoprocol. Now remember, you take the other agents here. So if you take the other agents, remember, for cholestasis associated pruritus, this clinical condition may respond to cholestyramine, 𝗓𝐸𝐷𝐸oxycholic acid, ondansetron, rifampicin and nalmefene, which is an opioid antagonist. And pruritus of uremia, it is most effectively treated with UVB radiation, and it may also respond to naltrexone and as well as omeprazole. And post-herpetic neuralgia and diabetic neuropathy, the individual will have the dysesthesia or burning sensation, and in that clinical condition, the capsaicin will reduce the burning sensation. Then you take the drug that is masoprocol. Masoprocol, it is a potent 5-lipoxygenase inhibitor with anti-tumor activity, effective for topical treatment of the actinic keratosis. So these are your other agents. So let me tell you, these are all the drugs which are used in the dermatological issues.